Hello everyone, we are Group 14. The members of group are Anita, Harneet Kaur, Harpreet Kaur, Jasmine Kaur and Robindeep Kaur. And today we are going to present the weekly deliverable 1 to 5.
Hi, myself Jasmine Kaur, and today I am going to explain weekly deliverable 1. Mr. Stanley Lundborg arrived to the hospital with the breathing difficulties, hypertension, and COPD. During his stay in the hospital, he acquired the disease condition of deep vein thrombosis. It is expected because of the carelessness of the admitting physician. The physician was more attentive on dealing with his current symptoms. The physician forgot to prescribe the prophylaxis of DVT, that is blood thinners, as usually patient admitted to the hospital receive this treatment. This mistake caused harm to the patient as he developed DVT. The healthcare team should communicate actively and discuss the case regularly to check if anything was missed. If there is a good conversation among all health departments, proper diagnostic tests and history taking, this will help prevent the occurrence of deep vein thrombosis.
Hello everyone, this is Robindeep Kaur and I am going to explain the weekly deliverable 2. In this case, Mr. Lundberg suffered from the seizure, impaired kidney dysfunction and blood clots. Due to the kidney dysfunction, intravenous medication is given to treat the blood clot, which increased the patient's stay in the hospital. On the 8th day in the hospital at 10 p.m., the patient fell from the bed and the housekeeping staff notified that and they immediately called the healthcare team. Then the healthcare team member determined the seizure activity of the patient. Firstly, the healthcare team administered the IV medication to stop the patient's seizure activity. Secondly, to determine any injury and internal bleeding in the brain, they conduct CT scan of his head because no one noticed the fall down of the Mr. Lundberg. When the mental condition of the Mr. Lundberg stable, he complained pain in his left shoulder and elbow. To find out any fracture in his shoulder, they performed an X-ray which revealed no evidence of fracture. After that, the overnight staff nurse find out the cause of the seizure. She noticed that one of the patient's seizure medication, levetiracetam, had not been administered due to the unavailability of that medication in the stock. It concluded that the lack of communication between the physician and the healthcare team, because the nurse didn't notify about that to the physician and even to the pharmacist.
Hello everyone, my name is Anita. I'm going to present weekly deliverable 3. In this given case study, Mr. Berkman, who had colon surgery, complained that she gets high insulin. After examination, it was seen that the nurse administered 80 units of insulin. However, the doctor prescribed only 8 units. It implies that the nurse had made the medication error. She has been given an extra amount of insulin. Along with this, she did not assess the medication chart for clarification. Moreover, the nurse did not acknowledge her mistake. Even patient complained about the high dose. It could cause more health complications.
Good afternoon, ma'am. I'm going to explain the weekly deliverable 4th. In this scenario, Rogers Young, who had a road accident and he also suffers from a femur bone fracture. Also, Rogers' friend Joe was also admitted to the hospital as he has right hemisphere cerebrovascular accident and having urinary tract infection. Rogers often take care of his friend and provide him help in moving and moreover he was also suffering from ESBL. This comment was unnoticed by staff members and Rogers continued to provide help him. Rogers' girlfriend Donna visits Rogers frequently and they have intimate relationship with each other. Few days later, Donna was tested positive for ESBL after complaining for urinary tract infection.
Good afternoon, ma'am. Myself, Nitko, and I am here to presenting the weekly deliverable 5. In this case, John admitted to the hospital with severe pain and referred to the orthopedic surgeon. After CT scan, physician observed some activities in patient's femur and referred to the oncologist as there were symptoms of tumor. However, when the biopsy done, they did not find cancer. It indicates the incorrect patient diagnosis. Although physician take action immediately, but he failed to make an accurate diagnosis that can affect patient's mental health. Even physician did not notice that patient has good activities rather than hip pain and reached to the final decision without getting any lab reports. Thank you.